What are the new treatments available today for fecal incontinence? Well, there are several, so let me take a minute to describe what they are. First of all, fecal incontinence is a very vexing problem that's very challenging for people who are dealing with it. Sometimes it can be as minor as some seepage and wearing a pad intermittently, but for some people it can be even more severe, where there's very poor control and it limits decisions about going out or just living life and having social interactions. Regardless of the severity of it, though, it is a problem that can be improved greatly, and visiting with a professional about it can help a lot on reducing and mitigating the symptoms. So for starters, the best way to begin is just assessing how severe the problem is, and this can often be done just by a simple interview, a simple office exam, and sometimes some more sophisticated testing can really shed light on the problem. This can be done with an ultrasound exam that examines the strength of the sphincter muscles, and also with some nerve testing, which also tells us how well the nerves are working in controlling the sphincter muscles. After that evaluation, then there are a series of treatments or interventions that can be done. The simplest are just alterations of diet. Oftentimes, just changing one's diet to make the stools firmer in consistency can make a big difference in improving the bowel control and the fecal incontinence. Secondly, using medications that are anti-diarrheal medications that slow down and harden the stools can also be very successful at reducing the symptoms of fecal incontinence. So sometimes that's all we have to do is talk about diet and some medications. But today there are additional treatments which are also very non-invasive and are office-based that offer some real successful intervention for people struggling with this problem. The first is a type of injection that bulks up the sphincter muscle by injecting a polymer, a substance into the muscle tissue itself. This procedure is done in the office in most cases. It goes by the name of Celesta, and it basically bulks up the sphincter muscle and provides better control. This works in over half of people, and it's very non-invasive and very safe. A second recent treatment which has become very effective is a nerve modulation treatment that involves improving and controlling the nerves that go and innervate the muscles of the sphincter and the rectum. This also can be done in the office, and it's a pretty simple but very effective intervention for many people. Thirdly, there are cases in which a surgical sphincter reconstruction can be very helpful. This is not most patients, but this is a few people who've had a severe muscle disruption, for example, as a result of labor trauma when delivering a baby. So there are a range of treatments, and fixing the problem often starts with simply sharing the details of it and going through the severity of it and then outlining what treatment is going to work the best. But unlike many years ago where we didn't have very effective treatments, today I think we do have some very successful treatments that are also less invasive than treatments of the past.